Okay, good afternoon and welcome. I'm Dominic Marcellino, the Director of Strategy for Kajeet Enterprise, and I'm delighted to be the host of this webinar today, Enabling Pop-Up COVID-19 Vaccination Clinics. Kajeet is happy to be hosting this webinar with our partner, RCN. Today we'll be talking about how RCN is leveraging Kajeet's technology to enable efficient COVID-19 vaccination administration through its Pop-Up Network Kits. This conversation will have a moderated Q&A in the chat, so when you have questions, write them there, and Kirsten Kiley on our team will bring them to us at the end of the webinar. We like our webinars to be timely and action-oriented, and this one fits the bill. Administering COVID-19 vaccinations is going to be the major public health focus of the next half year, at least, and RCN has a solution that can help us in that process. Joining me in this conversation today is Gary Menees, the Director of Sales at RCN. Gary, do you want to take a minute to introduce yourself and RCN?
Yeah, good afternoon. Gary Menees here. I head up sales here at RCN. We are based on the East Coast. We are a Knoxville-based company. We've been providing solutions in the wireless space for about 8-9 years. Really excited to partner with Kajeet on these types of solutions, and really looking forward to going through this and really explaining kind of our approach to this unique situation.
That's great. Thanks a lot. So before we get into it, Gary, let's just talk a little bit about the flow of today. First, we're going to touch on what RCN was doing in the healthcare space before COVID, and then we'll talk about what you were seeing, and as the pandemic grew, what work went into conceiving a solution that you found could help. After that, we'll actually talk about the PopUp Network Kit and talk about who it can help, and we'll close by taking those questions that we were talking about. First, a little bit about us, though. Kajeet is headquartered in McLean, Virginia, just outside of Washington, D.C. We're still run and led by our founders, and we're dedicated to doing good in the world by enabling secure and easy access to the internet. In the world of IoT, we are your trusted, easy, and flexible partner. And our mission has led us to a number of products and solutions, from originally being an MVNO to providing cell phones to children. And now we're one of the country's leaders in providing secure and reliable multi-carrier connectivity solutions for students in school districts, as well as a variety of other industries, including field workers and healthcare. Bridging the digital divide for students and workers, patients and providers is the perfect fit for our mission and our solutions, as well as the conversation we're going to have today. So Gary, as we said, you are engaged in the healthcare space, your company is, but this isn't something that just came out of COVID. It was something you were doing beforehand. So talk to us a little bit about, the world of healthcare pre-COVID at RCN.
Sure. So our approach to healthcare has been before the box, before the network kit. Traditional healthcare opportunities would be in what you would consider failover, having a router, keep an office up and running if their internet was not working. And so you're in a typical healthcare environment, you have a lot of different devices, whether it's tablets, phones, different things that are connected, typically via Wi-Fi to their internet network in the healthcare system. And so for us, keeping that network up and running was key. So being able to have redundancy.
Sure.
Then we went through and developed this solution, and really it was really focused on another vertical. First off, more remote type environments. Think of construction, oil and gas, places like that. But we also noticed that, in this world that we're living in today, there was going to be, we can anticipate seeing a need of having these services extend out into the market. And kind of what got us thinking down this path.
Right. Exactly. So what you saw was there were needs, potentially opportunities for you to help and extend what you were already doing. And so maybe before we get into actually how you conceived of what you needed to add to what you were already doing to get to the kit, were there a number of other ideas that you kicked around before you settled on this, or was this sort of the one that became clear pretty quickly?
Well, we looked at some how to take what you have today in the office out mobile.
Right.
Really, are there ways to do that? And there are, but then you have to solve other problems. It creates other challenges. Meaning, if you have what you have today in the office, I got to have power.
Right.
I got to find, a lot of electrical cord. I got to find a big power strip. So we started looking at how, you can easily extend some of these things, but then it created other challenges as well. And so what we're really starting to look at is how to really mobilize.
Right.
We don't want healthcare to be thinking about connectivity. How
Sure.
to connect. We want them thinking of how am I going to execute. And so we
Right.
want to put solutions that was, basically turn on and ready to go.
Got it. Well, yeah. So then what you've developed is exactly this, a versatile solution. You want to kind of run us through, what was the starting point and what got you into the solution that we're
And,
talking about?
the evolution of this solution started off trying to solve remote locations. Again, construction, oil and gas. Think about those industries for a moment.
Sure.
They work in very remote areas. There's no power, very little coverage. You're not going to put up an access point for Wi-Fi. All these different challenges that
Right.
you're going to find. And so, from the back of a napkin, we started thinking about other solutions that we'd seen. How could we improve this? And so that's really how the kit itself kind of evolved. It came out of a necessity from oil and gas construction remote, and then we started looking at, okay, what are some of the other areas that we can assist in? And this is healthcare became kind of an obvious one.
Right. Right. And we'll touch on later the fact that, as you've already said, the kit is something that you can use in other places as well.
Right.
But very specifically, here are the details of the PopUp Network Kit. And do you want to kind of walk us through both, what's in the kit, and then a bit about how one would use it specifically for vaccination administration, which is what we've been talking a lot about.
So the value of this pop-up kit is it's instant. It's on, connect, and go.
Yep.
And so now you don't have to really worry about, do I have access to power? Do I have access to coverage? We know that the LTE networks are everywhere.
Sure.
And so you can actually put dual SIMs in here to make sure
Right.
to get coverage. And so what you have is you have a cradle point router.
Got it.
Antenna, you've got a battery, you've got the chargers, all included in a very tough case here that is lightweight, very durable, and very portable. And what's nice about this solution is, again, you're not having to think about how am I going to connect my devices. All you're doing is powering up, and through the cradle point, it'll have Wi-Fi to connect all your devices,
Right.
and then run off the network, the wireless network that is secure, that is available, and that's going to be able to provide you the connectivity necessary to get all the information you're going to have to need. You're not going to have to change your devices. You're not going to have to change out software and look for a right solution. You can take what you're using today in your offices, and if it's Wi-Fi connected here, and mobilize that out into the market.
Got it. A couple things that come to mind immediately. I mean, you said light, you actually said it twice. Like, what does it roughly weigh?
Yeah, it's about 15 pounds all in.
15 pounds.
It's
Got it.
not real
No,
heavy.
that's pretty light. Yeah, absolutely.
Yeah, we've seen other cases get up into the 40, 50 pounds where you
Right.
bend
Sure.
it, not at the back to lift it up. This is something you can actually carry around with you.
That's right. And then with respect to the battery, it sounds like it's not a lithium battery. You chose something that was FAA compliant, so you could actually ship it.
Yeah,
And not worry about it.
not have to worry about it. It's FAA compliant.
Yeah.
Up to 10 hours.
Mhm.
But then it can be plugged into a vehicle or an outlet.
Right.
If you have a vehicle nearby, you can just plug it in that, and that'll keep it powered as well. So it comes
Got it.
with AC and DC.
Oh, that's great. So then a couple questions then. What's the recharge time on the battery?
Typically, it's about 10 hours to recharge it up.
Okay. 10 hours up, 10 hours of use. Okay.
Yeah.
Got it. And then if I were, not me, but say somebody who's relatively savvy is setting this up, like how long from opening the box to setting this up does it roughly take?
It's typically power on. It's like as soon as you power this thing on,
Yep.
it's easy. All the connections, you open up the lid, the connections there, the AC and the DC. You make sure that the battery is fully charged. There's a battery meter in there. It'll let you know its charge range. Once it's charged, it's simply just powering it on, and it starts broadcasting its Wi-Fi credentials. You look at that, you connect to it, and then you're up and running.
That's amazing. So sounds like just a couple of minutes, right?
Yes.
The time to make a cellular connection and then to connect the devices. That's great. So, at the end and behind this is actually the collaboration that we have. So the connectivity solutions and the private network is actually what from Kajeet is what RCN's leveraging here. And we talked about a couple of these other use cases. This is how we work together. Do you want to highlight just for a second some of the other use cases that that you see, in terms of us in our collaboration?
Yeah, what's important here to know is that you're not just getting hardware and now I got to go find how am I going to connect it to the network, right? All you're really doing is powering it up, connecting, and going. It's really, we can provide you the options of different data programs, data plans. So that's really the only decision is how much data you're going to need.
Right.
That's the things that we work out together, right?
Absolutely.
Healthcare, whether you are, for example, a food truck, you could be a food construction is another.
Sure.
So anything that requires mobility and you don't have access to a couple things. One, you rely on Wi-Fi to connect your devices. You don't have Wi-Fi readily available. This gives you. Two, you don't have power. You don't have a power strip. You don't have the types of things that will help you keep a lot of different devices powered up and charged up.
Right.
So we look at, the vaccination mobilization that's going on. What we're seeing is a lot of healthcare companies and a lot of healthcare customers are looking for ways to get out into the community. And the one thing that's holding them back, frankly, is that ability to bring all that devices and to bring all those solutions and really just set up anywhere, literally pop it up, pop-up kit, turn it on, and you're collecting data. You know exactly who you put shots in. It's a lofty objective to try to get 100 million shots into arms in 100 days.
Yeah.
All we're trying to solve in this equation is the connectivity piece. You don't have to worry about that. We have a solution for you.
That's great. Yeah, absolutely. And these, when turning back to the kit for a minute, these were some of the provider types that we were discussing, and anything in particular you'd want to highlight here where maybe, what you've seen looks a little bit different depending on the provider type, or
no, I think
flavor here.
The intention is everyone is trying to get as much on the vaccination side. Some key things that are critical. One, who have we vaccinated? We got to be able to keep records of that. And you got to be able to update that records. Different organizations across at the state level, at the federal level, are all tracking that information so we can provide information, to the public. And so being able to get that in real time is critical. And so being able to connect those types of things that you have today, those types of software packages that you have today, sitting on Wi-Fi enabled devices, and then trying to find Wi-Fi, trying to find this, you don't have to.
Right.
So
it's just there.
It's there. And so, the one thing that's common throughout every one of these is you don't have to worry about connectivity. They've got a box, they can get 2 boxes, they can go cover an area wherever they need to be daily, different places. You can go to the same place twice now. They have the ability to go to different places and get closer and closer to the community.
That's great. Yeah, absolutely. I have to think about the grocery store that's across the street from me. It has a pharmacy in it, and I don't know, the way that DC has done it is the extra vaccination doses can be given out to just anybody that waits around, and I have to laugh at the people that are just like milling about at the grocery store all day long. But yeah, definitely you see a lot of different things, and definitely the ability, especially in larger states with like less dense populations, you have to go to the community in order to give the vaccinations. I think it's critical to have this.
Yeah, and think about that scenario you just mentioned.
Yep.
What's interesting about that is they may not even, milling around the pharmacy may not be the best place. Maybe what they need to do is move that out to the parking lot.
Sure.
So now you have that ability. You don't have to find out what the edge of your Wi-Fi coverage is.
That's right.
I'll just put it out there. You get closer to where you need to do this.
Right. Absolutely.
You're not basically, you don't have to worry about the limitations of where you can do it now.
Yeah, it's that flexibility of battery power plus all you need to do is find a cell signal and you can get to work. And wherever that needs to be. I mean, there are limitations, but it definitely extends this incredibly far. before we get to the offer, thinking beyond the pandemic, obviously RCN's not just, and this will go away or it'll be different. At some particular point, people will be thinking about how do I reuse this, or for other industries where it's the same sort of thing. We've mentioned it several times. Any of the specific elements of this that are worth highlighting for the people that are listening today when they think kind of not just about vaccination administration, but beyond that?
Well, it's, this box in its simplistic construction, its ability to connect very easily, really opens up yourself some new mobile opportunities. And so now you're not restricted. And so whether it's COVID vaccination, whether it's the flu shot, whether it's whatever you might want to look at from a healthcare standpoint, being able to go out into the community and provide some first care, upfront care. You have that ability now. You don't have to sit there and think about, we've got the vehicle, we got the pop-up kit, we're ready to go.
Yeah. Yeah. Awesome. Yeah. And, you already mentioned several other use cases, which are pretty compelling. Kirsten, do you want to join us again and pepper us with a few questions?
Sure, absolutely. So yeah, just a reminder, everyone, if you have any questions you want to ask Gary and or Dominic, just enter them in either the Q&A or chat and we'll get to them. But first, I wanted to ask Gary, sort of what happens if there's an issue or a problem that arises on the field when using the PopUp COVID Network Kit?
Yeah, every one of our kits will come with the customer service information inside it, 800 number. We have a tech lab that's manned here by RCN engineers who can answer any questions that you may have to ask, whether it's connectivity, how certain things work. It's pretty simple, but if you really have any technical question or just any other type questions, our tech lab is here to help.
Awesome. Great to know. Thanks, Gary. Excuse me, Dominic, I was wondering if you could talk more about the network guarantee offered by Kajeet and what that means.
Yeah, best network guarantee. And this is actually something that Gary alluded to in there, which is the nice feature of the hardware that they're using for the router, which is that you can use two network SIMs in there. You have the opportunity to try first one and then another network. And in terms of Kajeet itself, by being integrated with all the US carriers, in the event that the two that were initially selected didn't work, we could swap those out for another SIM card in order to try it. Oftentimes one would know in advance, at least with some idea, that maybe a backup carrier would be a good one to have. And there's nothing that would prohibit us in working with Gary going forward from putting all four US carrier SIMs into a pop-up kit, but that made sense. It all depends in the end on what the device can support. Nothing worse than trying to put a SIM into a device that isn't going to work on a specific network. But usually, and I know this is why they take advantage of this, by having two, you're ready to go, and that takes advantage of all of the private network capabilities that you get with working with Kajeet.
Sure, thanks, Dominic. And a question from Francis. You mentioned 5G a lot in this presentation. Will this solution work on 4G?
It does. It's a Cat 18 solution, and really that is an LTE 4G, but it's a very fast throughput solution today. So it does work on 4G. What we can help is on the pathway to 5G if you're curious about that. But the short-term answer is absolutely. This is purpose-built for the LTE network.
Awesome. And just to answer Violet's question, yes, we will send out a recording of this webinar afterwards, so you can look forward to that. Next, Dominic, could you talk a little bit about some of Kajeet's other customers who are active in the healthcare space and how we help them go to market?
Yeah, absolutely. We're super excited to be working with RCN on this one. A lot of our other healthcare partners are putting devices in the hands of either patients or providers. And that runs the gamut from some behavioral health, telehealth applications to a clinical trial that we're supporting in North Carolina that's related to the coronavirus as well. One of the more interesting ones where we're actually providing a complete device as a service offering is with a partner who's developed an application that allows for healthcare providers that do in-home care to actually abide by rules of electronic visit verification, which is a requirement for reimbursement with Medicare and Medicaid, where you actually have to verify with a geolocation that you are in a specific place delivering care at a specific time. Our partner developed the application, so it can transmit the signal that says I was giving care to so-and-so person at this specific place, but we got the device. We actually use a mobile device management software to lock it down to exactly those use cases that our customer has proposed. And then we manage the data, the private network, and all of the other aspects of this deployment, including reverse logistics, repair and replacement. In the end, we're an enablement company. And even when we're providing full solutions, what we're doing is enabling our customers to do something. In the case with RCN, it's enabling them to put these kits out in the world and for people to do things like administer vaccines. With these other customers, it's touching on other parts of remote health, be they rural customers or those that don't have internet access that need telehealth access in this age. Behavioral health is a really interesting one where you don't have to worry about the stigma of showing up in a place like at a psychologist's office. If you worry about what other people have to say about that, but you need that care, you can do it from your home and that goes away. But there are a lot of people out there who don't have connectivity, and being able to put a device in someone's hands to do a telehealth session is vital for them to have care. And that's what our customers are doing, and we're really excited to be part of that.
Great, thanks. 2 questions for Gary. First, is this available on any state contracts?
It is available. We are a part of a few of the state contracts today. Texas, California come to mind, Wisconsin. There's a few others that we are on contract today. That would be a question for my public sector team. But yeah, today we're part of a lot of the state contracts. It is available anywhere in the country. There is no limitation there. And so when it comes to these particular state contracts, there's a lot that we are on today that something like this would be available.
Great. And are you deploying the solution nationally?
So it is
at the moment.
So really no limitations here. As long as, the nice thing about working with Kajeet is we can find coverage. And so we'll put enough SIMs in that device, 1 or 2 SIMs, we're going to find a carrier that's going to give us the right coverage. So we're carrier independent, that's an advantage. So we're not limited by that. So we have a solution that's universal.
Great, thank you both. Any final questions folks have? If not, we can go ahead and wrap up.
All right, that's great. Well, thanks, Kirsten. If you need to reach out to either one of us, here are our email addresses, and we will write back to you in a timely fashion and get you in touch with the right people to help you. And anything that goes to us for the PopUp Kit, we'll be passing on to Gary. Gary, any final word?
Yeah, just like you said, if you have any questions, please don't hesitate to reach out. We're here to, I have people located throughout the country that are ready to engage and answer any questions that you may have. And yeah, we're ready and ready to really tackle this connectivity piece. And we have the ability to start getting these kits out and meeting that need.
That's awesome. Thanks a lot, Gary, for joining me today. And thanks to everybody for participating. Again, if you have any questions, feel free to reach out to us. And thanks a lot for joining us today.